Have you ever wondered how therapeutic care has evolved for chronic kidney disease patients over the years? In the early stages of understanding and treating chronic kidney disease, medical practitioners were faced with a daunting challenge. It was an era where the intricacies of the human body were just beginning to be unraveled. The kidneys, two small organs nestled in the lower back, were recognized for their essential role in regulating the body's fluid balance, filtering waste, and maintaining overall homeostasis. But how to treat them when they faltered? That was a question that loomed large. The first attempts at therapeutic care were rudimentary, often limited to dietary modifications and natural remedies, with mixed results. These methods, while beneficial to some degree, were insufficient in halting or reversing the progression of the disease. The lack of effective treatment options often led to a grim prognosis, with many patients succumbing to the illness. But the winds of change were beginning to blow. The late 19th and early 20th centuries marked the initial advancements in therapeutic care for chronic kidney disease. With the advent of medical technology and a deeper understanding of the disease, the first successful dialysis treatments were carried out. This was a significant milestone, a beacon of hope for those grappling with the disease. However, the road was far from smooth. The early dialysis machines were large and cumbersome, and the treatment itself was a lengthy and uncomfortable process. Yet, it was a step in the right direction. It marked the dawn of an era where the fight against chronic kidney disease became a realistic possibility rather than a distant dream. The challenges faced during these early stages were not in vain. They laid the groundwork for future developments, fostering a sense of resilience and determination within the medical community. These initial struggles and victories were the stepping stones to the therapeutic care we see today. Indeed, the journey of therapeutic care for chronic kidney disease patients has come a long way since these early stages. But this was just the beginning. As time passed, medical science made significant strides. Dialysis came into the picture. Dialysis, a term derived from the Greek word dialysis, meaning dissolution, was a game changer in the realm of chronic kidney disease treatment. It was like a ray of hope that emerged from the medical science horizon, promising to dissolve away the shadows cast by chronic kidney disease. This revolutionary treatment method offered a lifeline to patients whose kidneys were no longer able to perform their crucial function, filtering waste and excess fluid from the blood. With dialysis, an artificial process was introduced that could mimic the kidney's natural function, providing an alternative route to eliminate the body's toxic waste. Dialysis was not just a medical breakthrough, it was a life-altering intervention for chronic kidney disease patients. The advent of dialysis meant that patients could look forward to a better quality of life. They could manage their symptoms, slow the progression of the disease, and even maintain a certain level of normalcy in their everyday life. But dialysis was not just about prolonging life, it was about enhancing it too. It allowed patients to reclaim control over their lives, bringing a sense of relief, empowerment, and hope. It gave them the strength to combat the psychological challenges that often accompany chronic diseases. However, dialysis also brought along its own set of challenges. It demanded changes in lifestyle and diet, regular hospital visits, and a long-term commitment to treatment. Yet, it was a small price to pay for the lifeline it offered. The introduction of dialysis revolutionized the approach to chronic kidney disease treatment. It shifted the focus from merely managing the disease to improving the patient's quality of life. It underscored the importance of a holistic treatment approach, acknowledging the interconnectedness of physical health and psychological well-being. Dialysis marked a significant milestone in the evolution of therapeutic care for chronic kidney disease patients. But the journey didn't stop there. With the advent of transplant technology, a new era dawned in the therapeutic care of chronic kidney disease patients. This breakthrough brought about a significant shift in the way chronic kidney disease was managed. Instead of simply maintaining patients' lives through dialysis, doctors were now able to offer a more definitive solution, a new kidney that could potentially free patients from the constraints of their disease. The impact of kidney transplantation on patient survival was profound. Prior to transplantation, patients with chronic kidney disease were often tethered to a dialysis machine for hours at a time, multiple times a week. This process was not only time-consuming but also physically exhausting. Transplantation offered these patients an opportunity for a more normal life, a life not dictated by the schedule of a dialysis machine. But more than just improving survival, transplantation also significantly enhanced the quality of life for these patients. No longer were they bound by dietary restrictions or the need for frequent hospital visits. They could travel, work, and engage in physical activities just like anyone else. Their psychological well-being improved as well, as they were able to regain a sense of control over their lives. However, the journey of transplantation was not without its challenges. The search for a compatible donor, the risk of organ rejection, and the lifelong need for immunosuppressive drugs were some of the hurdles that patients and doctors had to overcome. Yet, advancements in transplantation technology and patient care continued to evolve. Innovative methods for organ preservation, improved surgical techniques, and more effective immunosuppressants were just a few of the strides made in this field. Transplantation marked a significant milestone in the evolution of therapeutic care for chronic kidney disease patients. It was a testament to the relentless pursuit of medical science for better treatments, better solutions, and ultimately, better lives for patients. Transplantation opened up new possibilities, bringing a ray of hope to chronic kidney disease patients, but the evolution continued. In the present day, we witness a plethora of innovative therapies that have further enhanced the therapeutic care of chronic kidney disease patients. The modern era has seen a shift towards a more holistic approach, encompassing not just the physiological aspect but also the psychological well-being of patients. Pharmacological treatments have evolved considerably, with a focus on managing symptoms and slowing disease progression. Medications such as angiotensin-converting enzyme inhibitors or ACE inhibitors and angiotensin receptor blockers, also known as ARBs, are commonly prescribed to lower blood pressure and protect the kidneys from further damage. However, therapeutic care goes beyond just medication. Lifestyle modifications are an integral part of managing chronic kidney disease. A balanced diet, regular exercise, and maintaining a healthy weight are pivotal. It is also crucial for patients to avoid substances that can harm the kidneys, like excessive alcohol and over-the-counter pain medications. The advent of personalized medicine has also revolutionized care. This approach tailors treatment to the individual patient, considering their genetic makeup, environment, and lifestyle. For instance, gene therapy is emerging as a promising approach to treat chronic kidney disease at its genetic roots, offering a potential cure rather than just symptom management. Now, let's cast our gaze into the future. The field of regenerative medicine holds immense promise. Stem cell therapy, for example, offers the potential to repair damaged kidney tissue, while bioengineering techniques might one day allow us to grow new kidneys in the lab. Artificial intelligence and machine learning are also being harnessed to predict disease progression and response to treatment, potentially enabling earlier intervention and better patient outcomes. The future holds immense promise, with cutting-edge research paving the way for more advanced and personalized therapeutic care for chronic kidney disease patients. The journey is long and challenging, but the advancements we've seen so far give us hope that we can continue to improve the lives of those living with chronic kidney disease. From the early days of rudimentary treatments to the present era of advanced therapies, the evolution of therapeutic care for chronic kidney disease patients has been a remarkable journey. We started with a time when the understanding of chronic kidney disease was minimal and the therapeutic options were limited. Patients faced a grim prognosis, with treatments focusing more on managing symptoms rather than addressing the disease itself. Then came the era of dialysis, a significant leap forward in the field of kidney healthcare. This period marked the beginning of a more focused approach to treatment, offering a lifeline to patients suffering from advanced stages of the disease. Dialysis brought about a significant improvement in survival rates and quality of life, proving to be a game changer in the management of chronic kidney disease. The subsequent rise of transplantation ushered in a new era in therapeutic care. Kidney transplants offered a more definitive solution, replacing the damaged kidney with a healthy one. While this procedure came with its own set of challenges, it signified a major milestone in the evolution of therapeutic care for chronic kidney disease patients. Fast forward to the present, and we find ourselves in the era of modern therapies and future perspectives. With advancements in medical technology and a deeper understanding of the disease, we are now able to offer more targeted and effective treatments. From the use of immunosuppressive drugs to innovative techniques like bioartificial kidneys, the field of kidney healthcare continues to evolve and innovate. As we continue to make strides in medical science, one thing remains certain. The journey of therapeutic care for chronic kidney disease patients is far from over. It's a journey of constant evolution and innovation, aiming at enhancing patient care and improving outcomes. This journey, while filled with challenges and obstacles, is also marked by hope and resilience, a testament to the relentless pursuit of better patient care in the field of kidney healthcare.